Obesity is a disease of fat accumulation. How it is calculated? The ideal body weight has been defined by international standards. If your weight is more than 20%, you are supposed to be an obese person. And if it is more than 50%, then we call it severe obesity or morbid obesity. The treatment of obesity consists of diet and exercise and a very limited role of medication. But most of the time, this doesn't help to the people who are severely obese or morbidly obese. Why morbid obesity is considered a risk factor? Because once the person becomes morbid, he starts getting multiple problems, or we call it comorbidities. And those consist of diabetes, hypertension, stroke, osteoarthritis, and many hormonal conditions as well as cancers. And these comorbidities, once you start developing, then your risk increases and the life expectancy decreases. And it can decrease with every 10 kilogram of extra weight to 3 years of that person's life. And that is the reason it is very important that once you are morbidly obese, having comorbidities or even without comorbidities, you have to think about reducing your weight or weight loss. And as per medical evidence, it suggests that once diet and exercise doesn't help, one has to consider a surgery, and that surgery is called bariatric surgery or weight loss surgery. This surgery nowadays has become very simple because of the advancement in medical technologies, where we can perform it laparoscopically. We use many tools like staplers, harmonic, and even recently robotics. And then there are 3 types of surgery which are very commonly done. First is a sleeve gastrectomy, where our stomach size has been reduced, which is around 1.5 liter, has to be reduced to 300 to 400 ml. What it results into is once the person starts eating after the surgery, his diet becomes a small meal, which is as good as going on a strict diet, but this becomes automatic now because that person doesn't feel hungry once his stomach is full, and this continues for life. The weight loss occurs for a period of 1 to 1.5 years but remains throughout the person's life. The second type of surgery is called gastric bypass, and recently it has been simplified to mini gastric bypass. What we do here again, we reduce the size of the stomach, but in addition to reducing the size of the stomach, we join the second part of our small intestine to that stomach pouch, where the first portion of small intestine is bypassed, and this effectively almost resolves the diabetes or related cardiac cholesterol related ailments, and this gives a long-term result of resolution of comorbidities of obesity. Third type is what we consider is a sleeve gastrectomy plus sleeve procedures, where sleeve gastrectomy, as like I said before, has been done, and then we add a component of a bypass of a small intestine to that surgery, and that again acts like a gastric bypass surgery. These surgeries are very effective in reducing weight as well as resolution of your diabetes and most of the comorbid conditions. But it's not all the way, once you do the surgery, you should relax. You have to follow your doctors, your dietitians for post-operative diet and exercise plans. Because sometimes you might get haywire in your eating habits, like you can go on having snacks, or you can have a sweets or high calorie liquids which will minimize the effect of surgery, and you might start regaining weight. And that's why your follow-up is very, very important. And secondly, follow-up is important because you might get nutritional deficiencies if you don't have a balanced diet after your surgery. So, fellows and my dear friends and patients, you must consider this surgery and weigh against your risk to your life. Thank you.